presentation is a presentation from Wirraka Mayor, and we've got Gary Brahim, who is Senior Aboriginal Health Practitioner, and Tania Kelly, who's also an Aboriginal Health Practitioner, and they're from the Chronic Disease Unit. And Gary told me today that Wirraka Mayor means healing tree.
First of all, I'd just like to pay respects to the past and present elders of the Stand West Timber today, the Wirraka people, Donald, and Australian areas. First of all, Wirraka Mayor Health Service was first established in 1997 from the efforts of the Aboriginal people to address the unmet needs of the local people in the Port Edwin, South Edwin and Pilbara surrounding communities, and that it brings in the Western Desert communities as like Quindu, Cotton Creek, as well. It was designed to ensure our clients' journey through the health systems that meet the medical, health, social and cultural needs. Wirraka Mayor is providing holistic health care and wellbeing program operating services from 2 facilities as shown in below the diagrams on the screen here. Clinical service side is like QAAMS, that comes under the chronic health side. We've got maternal health, child health, aged care and visits, chronic disease programs, specialised service clients, clinics for the clients that come in or patients. And that's like every 2 or 3 weeks, up to a month with the optometrist. We have an on-site pharmacy, which makes it easier for our patients to, when they come in, they access the service, and as they go out, they can go into the pharmacy and get their medications, emergency packs, anything like that. And they've got do home visits too. We've got a pharmacist that comes in on a part-time basis and does like 1 to 2 days home visits, home medication reviews and all that as well. So people got issues with their medication or just been diagnosed with diabetes or any chronic health diseases that you have.
She also goes in with Gary into dialysis unit,
The microphone.
and then me and her go out for our patients.
And we operate a remote clinic service to Wirraka, which me and Tania, myself and doctors, a couple of med students, we sort of coordinate that over the last year or 2 now. We've got transport services, we've got PACs on board, and we've got a person that works in that program. We get a lot of clients that go down to Perth. We've got about 16 clients now on dialysis and waiting to come back for a bed in Port Edwin. And we're at full capacity of about 35 already at the local unit. Social Emotional Wellbeing Centre, transition good to adulthood. We've got personal health mentor program, that's part of the mental health support service team. Counselling services, we have a psychologist. He comes up from grads on a visit every 2 or 3 weeks, and he does about 2.5 days there. He sees a fair few clients. We've got a health promotional officer. We've got Indigenous healing program, and then Mary McKillop Family Services runs out of it as well. Our QAAMS program came about at Wirraka Mayor. The Wirraka Mayor staff member attended a chronic disease conference in 2009, identifying the needs and benefits of having a DCA machine at the service. Diabetes is one of the leading chronic diseases among Aboriginal and Torres Strait people within the Pilbara region and throughout Australia. Benefit of introducing a DCA machine to Wirraka Mayor included the results can be obtained quickly and more effective. The results can be obtained on-site, less referrals to the hospital, which reduces the pressure on the hospital resources. A faster result to the doctor health profession to take immediate actions to other referrals and implement health programs. Plans, which is GP management plans. A more convenient, positive experience for the client, and obviously it's a business operation or service delivery that we generate money both ways off the client and off the service we're doing through Wirraka Medicare. Our client base of diabetes patients, currently we have about 400 clients who we work with in partnership. as our recall service, and there's about four of us in the team. We take on about 150 patients for caseload. The majority of the times, there's other jobs you can see. The majority of these clients are Aboriginal and Torres Strait Island, and a handful of them are non-Indigenous other nationalities that use our service. The recall clients will have, recall system clients will have HVAC reading every 3 months, ACR testing every 6 months. Our clients can include referrals from the Wirraka doctors who may request these tests for their clients during consults. DCA Advantage Analyze allows regular and effective monitoring of diabetic clients. For quick reading reaction plans for further events can be determined. All Aboriginal Torres Strait must have the Aboriginal Torres Strait health check performance every 12 months. Aboriginal Torres Strait Island client that have been diagnosed with a chronic disease, example type 2 diabetes, or commence on the GP plan 10-care arrangement, are appropriately tested using this machine.
That's where, when they go through, get their GP name, that's where the referrals from that part, and then we got to follow them up.
Would you use the microphone, please?
So once they get their GP name, and we end up with all the referrals, and then we split them up between the four of us, and then we follow our own people up. We're transporting, get them into see a podiatrist, dentist, diabetes educator. Yeah. We also do the felt plan too, and we do it with the new FMG training group. Go and educate them about chronic about diabetes and the way they eat and stuff like that. Do their blood pressures and weight and height and stuff. And then we get them to come back and see us and do a full health check.